The cool air feels good.
But what was that movie? I was watching this movie where the person in the movie, I'm trying to think of the actor. He supposedly invented the cup sleeve that goes over the hot cup that Starbucks hands you.
Oh.
The cardboard thing.
Mm-hmm. Oh.
Supposedly he invented that. I mean, it's probably not true because it was just a movie.
Well, sometimes they're based on fact.
It could be. But he got paid 5 cents per sleeve.
Well, you know, I heard something similar. You know the orange cones when you go on a construction?
Uh-huh.
The guy that invented those orange cones, I think he gets a nickel a cone.
A cone. So I would have charged 5 cents per tray.
Oh, you'd have your own private island somewhere.
I know, that would be great.
You know, I called 2 days ago. No, Monday.
Mm-hmm.
And I forgot who I talked to, but I said, the nurse I saw said that I could request her.
Yeah.
But she wouldn't, couldn't guarantee that I would get her. She goes, oh, well, what's her name? And I said, Tracy. And she goes, oh, that would be great if we had a Tracy here. I felt so embarrassed. I was like, oh my God, I forgot.
It's close. She probably knew who you meant.
She did.
We have I get called Stephanie a lot, or Tracy. Those are the two most common
And they
names.
call that a veil?
Huh? Oh,
That's a
this is a
veil?
wound veil.
What's the purpose of that?
It's non-stick,
Mm-hmm.
so we can put anything on top of it. It won't pull up
I see.
your graft. Are you doing a docudrama here? A documentary?
You suggested I do that. Last time I was here, you go, why take a picture? You could just video
Yeah,
it.
you could video.
I thought, okay. Dr. Ozeda at Occupational Health, he likes to see the pictures. And then my sister-in-law in the emergency room, they're always checking on me.
Uh-huh.
How's it going?
Yeah.
She thinks you guys here are just godsends.
If I can't get that on.
When she found out I was coming here, she was so happy.
You can stop filming. I can't get this off. Here it is. Okay. Why won't that come off? Take the clothes off. There we go.
I mean, a booger.
Yeah, just that one piece. Okay. All right.
So how did you like doing training?
For this, well, this didn't really require a lot of training since it's just on the job. Because if you've been a nurse for many years, you already do a lot of this. I guess it was mostly just, doing some clinical rotations with the girls here when I was training to do this. And going outside, like to nursing homes and whatnot, and doing rotation there.
Now, I would imagine that not every nurse would like this type of work.
No, this is considered the trenches. This is not very, I want to say, it's not the most glamorous part of nursing, but to me it's the most rewarding.
Mm-hmm.
Because we actually see wounds heal. If you are a nurse in the hospital, your patients either die or they go home before you actually see that they got better.
Uh-huh.
Here we see you from beginning to end. So we have outcomes.
Uh-huh.
That your wound will be healed by the time you leave here.
Mm-hmm.
So we actually feel like we're doing good work.
But what is ostomy?
The ostomy has to do with the, means opening your mouth.
Stacy, can you call the front desk?
And it's usually an artificial diversion for bowel or bladder. And so we teach people how to manage that. Uh-huh. Yes. Uh-huh. Okay. Okay. I don't know anything about the doctor writing a prescription. He hasn't had his pad here because it got stolen. So, okay. Yeah, I would imagine, because he and I didn't discuss getting the phone number or anything like that. So it probably was just calling in a refill. I guess I could. I mean, it's a lie, but I could do it. I mean, somewhat. I mean, it's not bad, really. But I can. Well, I can ask, and I can go in. I do not recall. There's only one patient that I remember last week that he needed a phone number for, and it was not. But I can check it out. They can do that, and then the pharmacy tries to call the doctor, and then the doctor, if he's available, will say yes or no. Okay. All right. Yeah. Okay. All right. Bye. That was Donna. She's asking me about you're needing a refill for your Vicodin. Do you still need it, or because Workman's Comp is questioning our notes? I don't always write down you have pain at a level of 10, because you don't. But if you're still having pain or discomfort, I need to make an additional note.
Yeah, I would like to just have it on hand, just as a, I don't take it if I don't need it. If that makes any sense. I think I'm down to like 6.
Had you called in for a refill? Is that why they're trying to reach us or Dr. Gill?
No, I don't think so.
Okay. It's maybe Workman's Comp then. They're probably just needing our notes that say why you still require pain medication. So it's fine. I'll just...
Well, if I do get a refill, I don't think I need the 750s. I think the 500 would be...
Do not look a gift horse in the mouth.
Oh, okay.
Basically, it's really hard to get a change of prescription. And it's just...
Well, just a refill would be...
Yeah. But Dr. Gill isn't here until tomorrow. So, I'll take care of it. I have to go back to your last note and write something, a blurb.
I did something naughty when I was in high school. I told you my father was a pharmacist. Well, he had every doctor in Madera prescription pad on the prescription counter.
Oh, no.
And one time we decided to ditch school because we wanted to go to the lake. And the teacher says, well, you're going to have to bring in a note.
From the doctor.
So I scribbled a little something on a doctor's prescription pad. And they bought it.
That is
Only
bad.
the one time. That
is
is bad.
That's not as bad as writing a script for Vicodin or some sort of
No.
psychotropic medication.
No, just got me out of class for the day. Young and dumb.
I remember in high school, it wasn't such a big deal, but I guess it was a big deal. Some of my nefarious friends used to get a hold of prescription drugs. I don't know how they did it. And of course, I didn't hang out with them that much. I just knew about it.
Mm-hmm.
I guess there's kids in every...
And just so you know, your face is not in any of this.
Yeah, oh, okay. Well, no, that's fine.
Okay.
All right.
Then we don't get to get your pretty
No,
face
you
in
don't
it.
need to get my face. Okay.
Looks like it's tight. Do I get a gold star for today?
Mm-hmm.
Okay.
Does it move around? Check your ankle. Can you move it?
It feels nice.
Okay.
It feels snug.
I think what's happening is my guess is that, remember I said the wound veil, nothing will stick to it? Even what you put on top doesn't stick to it. And so when you move, you might feel it sliding.
I think
But
that's what it is.
it's not going anywhere. It's just, you know, and then your skin looks good, so it's not irritated.
That's great.
I think you're